Technology plays a central role in medical activities. Nevertheless, the healthcare technology industry is fragmented in Europe, especially when it comes to rules and operational standards across the continent. The consequence, businesses selling the machinery have a limited ability to operate as part of a single market. Integrating the healthcare enterprise is among the initiatives helping the health sector to better connect with the market. The IHE helps provide rules that allow clinicians, industry and patients to share information. In Montreux, Switzerland, an international event called Connectathon has gathered various different actors from the health sector to discuss common challenges they face and test their health products. Their experience is also being considered for the implementation of the upcoming European health data space.
The
industry, through its products, acts as a bridge between legislation and the users of clinical data, whether they are patients or doctors. Synergy happens when institutions adopt interoperability frameworks based on international standards.
But there are several challenges facing European national healthcare systems. Here, for example, we see a patient who regularly undergoes heart checkups. The problem is that the results are often not shared between the different healthcare centers. IHE proposes a partnership between users, suppliers and healthcare establishments to set up protocols explaining how health data should be shared. However, creating such an interconnected framework is a complex task indeed. So let's see how it works, thanks to the explanation of a Swiss cyber health expert.
There are several challenges. The first is to establish a legal basis to allow the exchange of health data, the sharing of documents, so that the patient can control who will access it. Then we have the technical questions to understand how the different systems will exchange and communicate with each other. And this is where IHE plays an important role by providing the standards to enable this interoperability.
In digital health, standards and interoperability are critical to help the system run properly and provide patients with quality care. Standards are a set of rules that enable communication between the health systems, while interoperability means exchanging data in a coordinated manner. At the Swiss Connectathon event, dozens of medical products and software are tested by IHE experts to verify if they match with protocols set up in several domains, such as radiology, cardiology, patient care coordination, and laboratory medicine, for instance.
The software creators taking part in the event aim to test the exchanges between their system and the other software systems, which are modeled on real use cases.
When it comes to authorizing access to patient health data, IT experts foresee a case-by-case option.
We can imagine that consent will be by default, and then it will be up to the patient to decide which health professional has access to which data. On the other hand, a patient could say, I don't want my data to be accessed unless I'm admitted to the emergency room, and they really need to access it to treat me.
The European Health Data Space Initiative will add momentum to the digital transformation of the healthcare systems. Moreover, in that new scenario, sharing data with digital health companies will help to deliver more patient-centered healthcare solutions.